Want to understand how and why gallstones impact millions worldwide? Welcome back to Carnivore Nation. Today we're diving into a topic that affects millions worldwide, gallstones. Whether you're a long-time follower of the carnivore lifestyle or just curious about health, this video is packed with essential insights. So let's get into it. First up, let's talk about why we have a gallbladder and its purpose. The primary purpose of the gallbladder is to store and concentrate bile, a digestive fluid produced by the liver. The liver continuously produces bile, which is essential for the digestion and absorption of fats. The gallbladder stores this bile between meals, allowing it to be readily available when needed. While in the gallbladder, bile is concentrated by the removal of water and electrolytes. This process increases the potency of bile, making it more effective in the digestion of fats. When food, particularly fatty food, enters the small intestine, the hormone cholecystokinin is released. This hormone signals the gallbladder to contract and release concentrated bile into the small intestine through the bile ducts. The bile then aids in the digestion and absorption of dietary fats and fat-soluble vitamins A, D, E, and K. So how do gallstones form? The main reason is when there is an imbalance in the substances that make up bile, leading to the precipitation of solid particles. Several factors contribute to this imbalance. 1. Excess cholesterol in bile. The liver normally dissolves cholesterol using bile salts. If the liver excretes more cholesterol than the bile can dissolve, the excess cholesterol may form crystals that grow into stones. 2. Excess bilirubin in bile. Bilirubin is a chemical produced during the normal breakdown of red blood cells. Certain conditions such as cirrhosis, biliary tract infections and certain blood disorders cause the liver to produce too much bilirubin, which can lead to the formation of gallstones. 3. Concentrated bile. If the gallbladder does not empty completely or often enough, bile can become overly concentrated, contributing to the formation of gallstones. Several risk factors increase the likelihood of developing gallstones. Firstly, obesity. Excess body weight increases the amount of cholesterol in bile. According to a landmark study in The Lancet, found a strong link between diets high in refined sugars, high insulin levels, and both low and excessively high fat levels can all contribute to gallstone formation. Apparently, low-fat diets result in less stimulus for the gallbladder to contract and release bile, leading to stagnation, meaning the bile stays in the gallbladder for extended periods. Adversely, excessively high-fat diets can cause the liver to overproduce cholesterol and oversaturate the bile, risking the remaining cholesterol to potentially crystallize. If you want to understand more about the impact of high insulin levels and see our video on insulin resistances here. Age and gender can also be a factor, as gallstones are more common in women and people over the age of 40. Also, hormonal changes during pregnancy can slow gallbladder movement and increase cholesterol levels in bile. Certain medical conditions, diabetes, liver disease, and some blood disorders can increase the risk of gallstones. For those on a carnivore keto lifestyle, they need to be mindful that rapid weight loss can mean the liver does not adjust quick enough and may secrete too much cholesterol into bile. Then that is needed. Genetics can play a part. With family history of gallstones will most certainly increase the risk. Finally, some medications such as hormone replacement therapy and certain cholesterol-lowering drugs can increase the risk. Gallstones can vary in size and number and may be composed mainly of cholesterol, bilirubin, or a mixture of these substances. Depending on their size and location, they can cause symptoms or complications, such as gallbladder inflammation, cholecystitis, bile duct obstruction, and pancreatitis. Recent studies, like one published in the Digestive Diseases and Sciences, show that non-surgical treatments, such as oral bile acid, can effectively dissolve certain types of gallstones. This is especially true for small cholesterol-rich stones, and it doesn't stop there. Technological advancements are revolutionizing how we treat gallstones. According to Annals of Surgery, robotic-assisted cholecystectomies are making surgeries safer and reducing hospital stays. With gallstone research pushing towards personalized treatment approaches, a study in hepatology highlights the role of genetics. It turns out your DNA can influence your risk of developing gallstones. So, what can you do to minimize your risk? Besides medical interventions, lifestyle adjustments play a critical role. Maintaining the right diet for that individual and staying active are key preventative measures. Interested in learning more about your health and how to prevent conditions like gallstones? Check out resources like PubMed and the Cochrane Library for the latest research. Thanks for watching. If you found this video helpful, don't forget to like, subscribe and click that notification bell for more updates. Here at Carnivore Nation, we're all about diving deep into health topics that matter to you and presenting them in a clear and precise way. Stay tuned for more, stay healthy, stay informed, and keep supporting our channel.